nation as part of an unprecedented program by Boston health officials who discovered what they call an alarming trend. Blacks and Latinos disproportionately affected by the 2009 H1N1 outbreak in the city of Boston last spring.
3/4 of the people who were hospitalized in the city of Boston with flu were blacks and Latinos, even though they make up less than 50% of the population.
In Boston, health officials say underlying medical conditions like asthma and diabetes may be one factor, but there are other reasons as well. There's also the issue of money. Parents can't afford to stay home and take care of a sick child. That means the child goes to school, and the parent who may also be infected goes to work. Nationwide, the CDC found 50% of H1N1 deaths from April to August were among Black and Latino children. Still, Boston is one of the only cities tracking swine flu by race. Officials there now classify minorities as high risk, along with all pregnant women and children. Do you think Boston would have a higher mortality rate in the minority community were it not for this anticipated H1N1 vaccination program?
Absolutely. Absolutely.
Dr. Anita Barry and her team of epidemiologists discovered the trend, and nurses like Cindy Theodore targeted churches, tapping into the persuasive powers of pastors to get the word out.
They're in church every week, so that's one way to get to talk to these people and offer them the help.
Boston hopes to vaccinate roughly 300,000 people in the high-risk category. The CDC recently announced an estimated 540 children have died from H1N1 since the pandemic started in April. Deborah Thayerick, CNN, New York.
Well, mosque and Islamic schools caught in the middle of a government crackdown on businesses with